Hello and welcome to Brouse Chiropractic. I'm Dr. Tom. Chances are, if you're watching this video, you were referred here from your family members or maybe one of your friends. I'm here to dispel some of the myths surrounding chiropractic, about what chiropractic can do for you and what it can't do for you, when you should go to a chiropractor and when you shouldn't go to a chiropractor. You know, frequently I hear, I believe in chiropractic, or I'll be out and somebody will say, I don't believe in chiropractic. Honestly, most chiropractors really don't care if you believe in chiropractic, because chiropractic is not a religion. It's a science, it's an art, and it's a philosophy. What we really care about is that you understand chiropractic. And that's why I made this new patient orientation, so you can really understand what chiropractic is about and how you can get the most out of your care. To understand chiropractic, you need to learn about the nervous system. There's an estimated 40 trillion cells in the body, not including bacteria. Any guesses on what controls those 40 trillion cells? Yeah, it's your brain. Your brain controls all 40 trillion cells. It sends messages down to the cells, and the cell sends messages back to the brain and what it needs. It's this constant flow of communication that keeps that part of the body healthy. And it stays healthy unless there's some type of interference. The only thing chiropractors do is look for something called a subluxation, which is a bone out of place that's causing interference in these messages. There are different parts of the spine you'll need to know when you come to our office. There's the neck or the cervical, the thoracic or the mid-back, and the lumbar or the low back. You have these individual bones, which are called vertebrae, and in between these bones, you have these clear cushions called disc. They are like the shock absorbers of the spine. Now, down through the middle of the spine runs your spinal cord, and 31 pairs of nerves come off that go out to every single cell in your body. All 40 trillion cells in your body are connected through these nerves up through the spinal cord to your brain. That's all the parts of the spine you need to know when you come to our office. Now let's say T3, which is this bone right here, goes out of alignment, and the nerve that comes out there gets pinched. That nerve won't function properly. And that nerve just happens to go to your lungs, so your lungs won't function properly. So let's say you come into my office and say, hey doc, I got a lung problem. And I don't know what I can do for your lung problem, but if you happen to have this T3 out of alignment, I could put it back into alignment, and maybe that would help with the lung problem. And then you come in 2 days later and say, hey doc, you fixed my lungs. That wouldn't be true at all. All I did was put that vertebrae back into alignment, and your body did the healing. So never give a chiropractor any credit for the healing that may happen as a result of an adjustment. It's your body that does the healing. All we do is restore the communication between your brain and your body. Now this can happen in any part of your spine. In the lumbar spine or the low back, muscles can get tight, pull that bone out of place, and all of a sudden you got an L3 subluxation. Well, those nerves, not only do they go to the muscles of your low back, they also go to your digestive system. So many people come in and say, you fixed my digestive system. And that's not true at all. All we did was correct the subluxation in your low back, period. Now the neck is a little different. C1 is the very top vertebrae. On top of that, your skull sits. And you can see it's kind of shaped like a ring. And if that happens to go out of alignment, it can cause a lot of interference in your nervous system. And I have found that is the most beneficial adjustment I could ever give you if it happens to be out of alignment, which is just as consistent with the Palmer clinics they told us years ago, is always check the upper cervical region. In all the miracles of the body healing, I have seen more when we remove this C1 than any other vertebrae in the spine. It's one of the reasons we specialize in upper cervical adjusting along with full spine adjusting as well. So we're going to use a parable with this light. And basically, the electric outlet in the wall is going to represent your brain, and the cord is going to represent the nerves going from your brain to your tissues. And this dimmer is going to represent where two bones that go around the cord, and the light will be the organ. So if you have a bad subluxation, we wouldn't have much electricity or messages getting to that organ. Let's pretend this light is your stomach. So if you have a bad subluxation, well, just say you have a 10% subluxation at T6 because that's the gastric nerve. Say it goes down like 10%. So it's still bright. You're going to feel 90% healthy. Your body's in a state of dis-ease, not a disease. Dis-ease is your body's not at ease anymore. It's not functioning the way it should. You won't notice anything. You'll feel pretty good. But then all of a sudden it goes down to, let's say, 30%. Now you're starting to, you might burp or belch here and there. Maybe your stomach gets upset. So we know what to do. Belching, bloating, indigestion, diarrhea, Pepto-Bismol, right? So we do that for a while. That takes care of it. You know, you have it maybe once a week, every other week. Now it goes down to 50%. Now you have heartburn every single day. You're having a lot of indigestion. You see your medical doctor because he's going to give you what? Prilosec. Because if it's not taken care of, you can get erosion of the esophagus, which can lead to a lot of more serious conditions. We have to sherry if you would come in at that point. And then somebody waits even longer, it's down to like, say, 60% interference in that nerve. Now you have black tarry stools. Time to go to the chiropractor, right? No, it's not time to go to the chiropractor. We have to share you with your medical doctor. We got to get him on board. Then we need to remove that subluxation and turn you back into a bright light. We got to get that energy back to the stomach, because as long as there's still life in those cells, it can come back. You know, often patients come in and they're dim light bulbs. They've waited too long. The problem's gotten so severe. They've seen several medical providers, and we're their last hope. And, you know, despite all the damage, often when we remove the interference, their body starts to heal again. You know, so don't think of a chiropractor as some Russian worker trying to pop and crack your spine. Think of us more like electricians, looking for them dim light bulbs, restoring that communication between your brain and your body, removing that interference, correcting those subluxations, and so you can once again be a bright light. That's the true goal of every chiropractor. So how do we find these subluxations? Most patients are really amazed at how easily we find these subluxations. Basically, we feel along the spine, and we can actually feel spots in your spine where the vertebrae have moved out of alignment. It's called palpation. We also look at your range of motion. You ever been with somebody in the car and you notice they turn their whole body to look behind them because they can't move their head? A subluxation will ruin your range of motion. Another thing we can do is thermography. It's basically a $5,000 thermometer that measures the temperature from side to side of your spine and compares it to a baseline normal. And this fancy software figures out where your subluxations may be according to those temperatures. We can also do x-rays. In some cases, if they're not responding, or if it looks like you might have a lot of damage and some things we have to be careful about, or maybe even some damage that we may be able to help you with, we'll use x-rays to locate that as well. So when you come in the office, you may notice I don't pay the closest attention to your neck pain, your low back pain. The only reason I even listen to your symptoms is to find out how long you let the problem go on and determine whether you're a chiropractic patient or not. I have to determine whether I need to share you with a medical doctor because the problems became so severe. Ordinarily, I'll be able to adjust you, but my goal isn't to get rid of your symptoms. My goal is to remove the interference to allow your body to heal itself. See, I don't take any credit for you getting rid of your symptoms. My only goal is to remove the subluxation, remove that interference so your body can again start to heal and do what it was designed to do. Everybody always asks, you just suggested me, how come I'm out of alignment already? The answer is stress. And the neck most often is affected by emotional stress. You know, say you're watching the news, you get all uptight. Muscles called the trapezius muscle in the back, it literally pulls a bone out of place in your neck. On sun, that nerve supplies the blood vessels to the head, or maybe the pituitary gland, or something like that. What symptoms does the patient complain of? Headaches. So you come in, I adjust the subluxation, headaches go away the next day. You say, hey doc, you fixed my headaches. That wouldn't be true at all, would it? All I did was correct the subluxation, remove the interference, and allow your body to do what it was born to do. The second type of stress is physical stress. Bending, twisting, lifting improperly. And this most often affects your lower back. So if you're having a lot of chronic low back issues, more than likely you're not bending, twisting, or lifting properly. The third type of stress is the one everybody forgets about, chemical stress. Alcohol, preservatives in your food, bad water, viruses, bacteria even, smoking, and this typically affects the organs that go through your middle back or your thoracic spine. So if you're having a lot of chronic mid-back problems, we have to find out what kind of chronic stress is causing you to subluxate in that area. So these are the three types of stresses in the body: chemical, physical, and emotional stress, which causes subluxation. If you don't remember anything else from this class, this is the slide I want you to remember, because this will help you the most in keeping you and your family healthy. When you get stressed, it causes muscles to get tight, and that literally pulls the vertebrae out of place, pinching a nerve, causing a subluxation. And then when you get a subluxation, that's uncomfortable, so that creates more stress. It creates more electricity into the muscle, which pulls the vertebrae even further out of place. And eventually, this will cause you not to move right, cause a dysfunction. And then you might go to an MD, and he'll name it some type of disease. Maybe it's lumbosacral radiculopathy with some stenosis. And that makes you even more stressed. And he was hoping to help you with, finding out what's wrong with you. And then you get caught in this hamster wheel. We want to break that cycle, get you off the hamster wheel, and get you back to being healthy and living a life you enjoy. So what are some cost-effective ways to break the effects of stress on the muscles? One is exercise. Research shows simply 15 minutes of exercise a day will reduce the effects of stress on your muscles. Two is meditation. 10 to 15 minutes of meditation a day is also shown to reduce the effects of stress on your muscles. And third is even prayer. Prayer has been shown to reduce the effects of stress on the muscles as well. It takes at least 10 to 15 minutes of that as well too. And those are all free. Now, if you don't want to do those, who's uniquely qualified to break the effects of stress on the muscles? Massage therapist. How often should you see a massage therapist? Research shows every 7 to 10 days is what they recommend to reduce the effects of stress on the muscles. And people often tell me, I don't have $50 plus a tip to spend every 7 to 10 days. Well, if you wait too long and it causes subluxation from the effects of stress on the muscles, then who do you have to see? Your friendly neighborhood chiropractor. So we break the effects of stress on the muscles in two areas. One is right after it causes subluxation. Two is when you've waited too long and you've actually gone into dysfunction or disease. Then we break that cycle here, okay, to stop this cycle of stress on the muscles. Okay, chiropractic is about prevention. However, most patients that come into us have waited too long. They're already experienced symptoms or pain. And the number one question I get asked is, how often do I have to come in? Well, it depends. If you're already getting symptoms, you're already having pain, I recommend patients come in 3 times a week until we get your symptoms under control. It usually takes 2 or 3 months and we get patients stabilized. But it's always up to you. Now, as far as wellness or maintenance care, the research says every 7 to 14 days, which we'll get into a little later. But some people say, I'm not going to that crazy chiropractor every 7 to 14 days. And what happens is they wind up hurting so bad, and all of a sudden they can't move as much, they get dysfunction, and it gets really tight. And guess who they have to see now? They have to see a physical therapist. Their job is to get you stretched out, strengthened, and stabilized. So we have to work with these therapists because we still have to move the spine, but they have to get your muscles stretched, strengthened, and stabilized. Now you're looking at $75 a visit, and they need to see you 3 times a week, generally for about 3 to 6 months. Okay. Then some people say, there's no way I'm doing that. So it keeps on getting worse, and it gets into a severe state of dysfunction where you can't even get on my table. Now you're no longer a chiropractic patient. Now the person that breaks that cycle here is your surgeon, and sometimes he'll, might fuse your spine. You might cut a piece of the disc out, but you've waited too long. See, I think it's much more beneficial, not only health-wise, but also financial-wise, if we focus on prevention. Instead of trying to treat the problem at the end of the cycle, if we would actually catch it in the beginning, it's going to cost a lot less, and you're going to be a lot healthier, and you're going to have a lot more fun. Now, some people, they're used to watching TV, so I don't condone them for watching all the medical ads and all that, and they choose to go through the treatment cycle because they just don't know any better. My suggestion to you is to focus more on prevention for you and your family. Now, what's this every 7 to 14 days getting checked business? Well, in 1987, Dr. Vidman did a study on joints. He took rabbits, he bound up their knee joints, and then he would check that after some time. After 1 to 3 days, he didn't see much change. After 4 or 5 days, he started to see scar tissue form in the joints. After 14 days, he actually saw changes in the subchondral bone. Basically, he actually saw arthritis forming, or osteoarthritis. Some of you might be aware of arthritis. You had an x-ray already, and maybe your doctor told you have degenerative joint disease or degenerative disc disease from having that subluxation in there so long it's already forming. At that time, Dr. Vidman, he changed medicine, because before when you had knee surgery, you would just lay in a hospital bed. Now when you have knee surgery, as soon as you have that surgery, they get you out of bed, they get you moving right away, because they know if you have osteoarthritic changes in as little as 14 days, microscopically, that could be happening in minutes. So they want to prevent that, just like we want to prevent you from having symptoms or problems from a subluxation being in there too long. And that's why we really want to focus on prevention. Everybody wants a prescription for health, so I'm going to give you a prescription for health. Getting adjusted alone is not enough to keep you healthy. Getting adjusted will help increase the communication between your brain and your body and help you express life to its fullest. It'll help you heal faster, but it can't do everything. You need to eat well, you need to sleep well, you need to think well, and you need to move well, along with getting adjusted. And I'm not an expert in all these other things, but I can give you some quick tips. Move well. Science says 15 minutes a day. You can take a 15-minute walk every day. That's not so hard. Or you could do some yoga. But it's got to get consistent. It's got to become a habit that you do every day. Eat well. If it comes in a box, bag, or can, don't eat it. If you're reading the ingredients and you can't pronounce it, you probably shouldn't eat it. Try to stay away from those chemicals and eat foods that you actually have to cook or eat it raw is even better for most foods. Sleep well. The thing with sleeping is a lot of times people are watching the news before they go to bed, and that destroys your thinking well, and it actually can hurt a lot of sleep. There's been a lot of studies on that lately with the things that are going on. One of the easiest ways to get away from that is maybe just get a little notepad and write down 3 things you're happy about for the day. In the beginning, it might be simple. I had a good meal today. I felt pretty good today, or maybe I'm happy that I have a roof over my head. And eventually, it'll get more and more involved, but that'll help you go to bed with happy thoughts. Okay, and it'll also help you sleep longer. Now remember, you can't eat one healthy meal and expect that's the last healthy meal you ever have to eat again. Just like you can't go out and exercise for 15 minutes just one time and expect that's going to work. You have to do these things on a continuous basis to keep your body like a well-oiled machine. It's just like you can't expect it to get it just one time and say, boy, that's all I'm going to need. As long as you're alive, you're going to have constant stress on your body. You need to continuously do these things to help combat that, to help you maintain perfect health. I've told you the truth so far. I've told you the science behind chiropractic, but who needs to be checked? I believe everybody needs to be checked. I check my family. If they're subluxated, I adjust them. I adjust my wife, my kids, my in-laws, my parents, my brother. And the thing is, if you come into my office, does that mean you're automatically going to get adjusted? No. We check you. I check you for subluxation. If you're subluxated, we adjust you. If not, we don't. And I don't charge you if you don't get adjusted. So if you come in and we check your spine and you're doing all the things necessary to help prevent subluxation, there's a good chance you might be free of subluxation. There's no charge. We only charge when you get adjusted. My mission is to detect and correct subluxations in a fun and caring environment to help you and your friends and family restore your health and maintain your health. And everybody else in the community needs to be checked and adjusted when necessary. And you can help me fulfill this mission. You know, if you throw your friends and family a lifesaver, tell them the truth about chiropractic. Don't lie to them anymore. Don't tell them you go to the chiropractor because it helps you feel better. Show them how it works. Get your hands. Show them, you know, when a bone gets out of place, you're going to put pressure on the nerve that comes out, and that nerve goes to different cells and different organs, and it'll cause problems to where that goes to. And my chiropractor, he's going to put that bone back in place, get pressure off that nerve, and allow their body to heal better. See, now you are part of the informed minority. We want you to go out and educate the uninformed majority. You know, I started my career back in 1999. And since then, I have done many things. I have done ultrasound, stimulation, I've done decompression therapy, traction, vibration therapy, nutrition, electric acupuncture, cold laser, even oxygen therapy. We've tried a lot of different things because that's what I thought you needed to do to help people, and that's how I thought you were successful. But you know, the one thing I'd always intrigued me is when I had the sickest person in front of me, what did I rely on? What did I go to? I always adjusted them. And I also found all the miracles I have seen, most of them are getting adjusted, nothing more. And that's all we do here. You know, I remember one case one time I walked in to see this little girl's back when I wore a white coat and I was all professional. And I looked at this mom holding this it looked like a little baby. I mean, it looked like she was less than a year old. And she was jaundiced, but she was supposed to be like 18 months old. And Abby had been having her liver fail. She said every time they took her to Children's, which was once a month, her liver enzymes kept getting worse. And, you know, so we adjusted her. And I remember the moment I adjusted her, within seconds, this horrible smell, her bowels just went. And her mom proceeded to tell me that her bowels rarely ever moved, a few times a month at best. You know, I started her at 3 times a week, and her bowels moved 3 times a week. Her very first trip back to Pittsburgh, her liver enzymes, for the first time in her entire life, actually started to become more normal. I saw her 3 times a week for 6 months, and because she needed adjusted every time I saw her. And in those 6 months, her liver, her last visit in 6 months, was completely normal. She no longer needed to go back to Pittsburgh anymore. You know, a lot of people say, well, you saw her 3 times a week for 6 months, that's too much. Was it? Was it worth it? You know, and that's when I really learned about chiropractic. You know, chiropractic's not about feeling good or feeling bad. It's about health and life and restoring the body's healing ability. I mean, basically all we do is we look for the interference from the brain to the body, and we just try to restore that and allow that body to communicate. I didn't fix Abby's liver. I don't treat liver conditions. All I did was find a subluxation that was interfering with her body's natural processes. I adjusted that bone, and her body began to heal again. That's all chiropractors can do. Now, I know you'd like to sit there and listen to me for the rest of the evening, but the class is over. When you come in, don't hesitate to ask me any questions you may have. When you call, my assistant will answer any questions you may have on the phone as well. Please remember to take the quiz so I can give you the discount when you come in. You know, typically when you come into our office, the first time we always want an appointment. After that, you generally can just walk in. Generally, we never have more than a 10-minute wait. We keep everything moving. So thank you. Have a great night. I look forward to restoring the communication between your brain and all 40 trillion cells in your body.